Hello everyone, welcome to the video series on pharmacological classification of drugs. In this video, I will explain the drug treatment for amebiasis. Amebiasis is caused by a protozoa known as Entamoeba histolytica. Understand the word Entamoeba. It appears in amoeba shape. It affects enteric cavity. Histolytica, hista means tissue, lytica means it causes breakdown of tissue. So usually it is contracted when contaminated food or water is ingested with amoebic parasite. The organism in the form of cyst gets into lumen, develops there and affects our luminal tissue. So what happens is after getting into the lumen, after feeding on luminal tissue, it may get into tissues like liver and other tissues. So the treatment involves two kinds of drugs, luminal amebocytes or tissue amebocytes. Luminal amebocytes are the agents which will affect the organism when it is present in the lumen. So these agents are diloxanate furoate, idoquinol, paramomycin. Now understand about paramomycin. Paramomycin is an aminoglycoside. Aminoglycosides are never absorbed through the gut. They are very ionic in state, so hence they are given in injection forms like streptomycin and all. Paramomycin will not get absorbed. It will be there in our intestine and the intestinal organs will be affected by this paramomycin. Its mechanism of action is it inhibits protein synthesis. So these are only luminal amebocytes. There are drugs which will affect the organism in tissues. They are called as tissue amebocytes. Chloroquine is an example for tissue amebocyte. There are other drugs which affect both the sites, luminal amebocyte as well as tissue amebocytes. Drugs like metronidazole, tinidazole, ornidazole, emetine, dihydroemetine are example for this class of drugs. Now one more small thing. See, whenever amebiasis is there, it induces diarrhea. See, the reason why diarrhea is there is body tries to expel this organism from our lumen to the outside. That is what diarrhea is caused. Now, when such kind of diarrhea is there, people have two choices of drugs. One is loperamide, anti-motility agent. When people take loperamide, the intestinal motility is inhibited, diarrhea is stopped. But what happens? The reason why people have diarrhea is body is trying to throw out the organism. If people take loperamide, the motility is stopped, but organism stays inside, which will further damages intestine or gets into organs also. The other choice is antibiotic like metronidazole. The job of antibiotic is it will kill the organism. Though people still have diarrhea, the organism dies, it goes out. So the best choice to treat amoebic dysentery is an antibiotic like metronidazole, but not loperamide. Understand the differences between these two. If by chance people are taking loperamide, the organism stays inside, it may affect our tissues also. So always the choice of drug to treat such kind of amebiasis is using antibiotic like metronidazole or tinidazole. Thank you for watching this video. All the best.